Now let's dive deep into this big LGBTQ plus story for today. I'm Jameer Baptiste, and let's queer up South Florida and Florida. Can Community Health and Midland Medical sign on as the title sponsor for HOTspots Happening Out's Black Excellence Initiative? The healthcare organization Can Community Health and Midland Medical has come on board as the title sponsor of HOTspots Happening Out Black Excellence Initiative. The nonprofit's Black Excellence Initiative encompasses 3 main annual events. The Cookout, a Black History Month celebration, which took place on February 1st. The Wilton Manor Stonewall Pride Parade and Street Festival Black Excellence Stage and Lounge, taking place on June 14th, and Pride Fest, an LGBTQ plus Caribbean festival that takes place August 9th. The 2024 Can Community Health and Midland Medical sponsorship is a partnership that is seen to be a connection of synergy and community engagement. Statistics show that the Black and Brown communities represent the highest of marginalized communities that are affected by HIV, particularly here in Florida. With Can Community Health and Midland Medical sponsorship, HOTspots Happening Out can provide the community with a direct resource for care, treatment, and testing. It is an invaluable access to services that many in the community aren't exposed to. Now with the partnership, the community can experience belonging and joy at cultural events catered to them while also coming into direct contact with vital healthcare resources. So, to me, it's important because in that story speaks to the marginalization of our community and the lack of resources that occurs because of it. And yes, we at HOTspots Happening Out build these safe space cultural and social experiences, but we don't have a healthcare component. And we're lucky enough to build these experiences attracting that particular demographic because it's a cultural and social experience. So you tie that with a health organization and you give a resource and services to a community that normally doesn't have that at their fingertips. And I think that's a perfect recipe for success, I think it really speaks to what it means to build a partnership that has meaning and intention behind it. And it's just a noticeable, we can't deny that HIV and STIs are so damaging to our community, especially here in Florida.
South Florida.
Yeah, what are we at, Tonio? I think we're like this 10 years as like the highest HIV contraction rate.
I mean, between Broward County and Miami alone, it takes turns being number 1, and then I believe it's Duval County being number 3.
Right, you know.
So, it's
and it's like, how do we get there? Is this the perfect fix? We don't know. Of course, it's not the only thing that is working, but it's something to work towards. It's something to build towards. And I know that with you, First Lady Kendra, that you're with the EHE Council, which is ending the HIV epidemic, so you have firsthand knowledge of what this means to our community in terms of infection rates and lack of services and resources at their fingertips, and what this could potentially mean for individuals that are coming out to celebrate just a cultural experience, a fun experience like the Pride Fest, which is the LGBTQ Caribbean experience, but yet still getting to come in contact with a healthcare provider,
Right, because, Black women are 10 times higher to receive HIV than white women.
Right.
And to be access to healthcare is a good thing. So to go somewhere and someone can educate you on STDs, on HIV, because a lot of people think HIV is gone, it's disappeared. No, HIV is still here, and it's primarily in the Black and Brown communities. And to have Can and Midland step up, it's an honor. You know, to go to an event, to have people teach about education, and plus stigma. Stigma is one of the biggest issues in the Black community. About everyone's scared of what they don't know.
Right.
Get educated.
Right.
Get tested. Know your status. A person can be HIV possible. Everybody's HIV possible, but a person can be HIV and be undetectable, where they cannot transmit the disease.
Right. You equals you.
You equals you. So it's like you have it, but you don't have it, and you cannot infect anyone else. But we are so scared of stigma, we don't want to get tested. We rather sit and hide and die.
Right.
That's shameful.
Right.
Can I say something? What about the cuts, the future cuts to the PrEP and the
DoxyPep.
Right.
Yeah, that's
And
coming
for those
down
of
to-
us who don't know what PrEP is, you know, pre-exposure prophylactic is one of the daily pills that you could take to prevent HIV, you know, and DoxyPep, what Tonio just mentioned, you know, is to after the fact to ward off any STIs or specific ones, you know, not every single STI, but then there's PEP as well. If you're not on PrEP, you could take PEP. But back to what Todd was saying, what does that mean with the current administration and them rolling back federal aid for these programs? You know, I think that's even more of a reason why these connections are needed. And what really happens in terms of these things, because I know that not only the private sector like Can Community Health and Midland Medical, which is actually ran and operated by Can Community Health, will be affected as well, you know, but it's direct programs. And I remember just when we were on a little break, you know, the CDC was mentioned, and I know that's directly linked to your study research that you work with at HPTN 096, you know.
Correct.
And what does that mean for all these programs that are government, but then these programs that are private as well that get federal funding to offer these free aids? And how does that all correlate into our community now having another barrier to getting to it? Because we can only say that whatever it is, the job hasn't been effectively being done if we're still at the top of the list of contracting HIV, right? But we had resources there not getting to our everyone in our community. But what does that look like when those resources are now dialed back or completely taken away? You know, I think these partnerships are that much more important, you know, because what if the CDC programs or the ones that provide the free PrEP, and DoxyPep are taken away? Then all those people that don't have health insurance can no longer afford those medications or even their HIV treatment medications, you know? So how does this speak to that in terms of what that looks like? And so again, that's why I think these partnerships are important.
If I may interject, see, the thing about it is, like, with the program that I work with, which is the HIV Prevention Trials Network, is specifically geared towards 15 years or older Black, queer, gay, bisexual men, and it's also inclusive to transmasculine or transmass people as well. So I just wanted to get that out the way. However, even though as a peer supporter, the job is to get these people access, you know, to PrEP and DoxyPep and to create these resource directories. Chocolate City, you guys are actually on one of our, you guys are on our, yep. Yeah, it's a hard job, but however, I mean, it's a very great job. But when it comes to the PrEP and DoxyPep, I believe what we need to do is to market it not only towards just the Black queer community. The heterosexual community can also take PrEP and DoxyPep. Women can take PrEP and DoxyPep. It's not just for Black gay people or gay people in general. PrEP is a pill, period, to prevent HIV, but you have to be HIV negative in order to take the pill. If you're HIV positive, the pill does not work. So the education needs to matriculate not only just within the Black queer community. PrEP is for everybody, every race, every gender. If you are sexually active, then you need to be on PrEP.
Right. Oh, and that's a great point. You know, that's a very good point. You know, even with the gay male black community at the top of the,
Commercial, right? It's all, I mean, it's gay. No.
but even with us, because it's undeniable to say that we're not at the top of the list of
Right.
HIV contraction, right? But the second on the list is black women, and that's not.
Well, first of all, I'm gonna correct that. Black women are the number one on the list.
Oh yeah.
You're number one on the list.
Wow.
Black women.
So you see, it touches each community.
Black man, black gay man, black woman. It just goes, goes
Right,
around in circles.
right, and that's why again, and not to just constantly tote this partnership, but you know, the Black Excellent Initiative through the hotspots happening now speaks to the cookout as well that we just talked about as a family oriented event. You know, so it's also putting our straight heterosexual allies and counterparts at the fingertip of care as well.
Absolutely.
You know, the LGBTQ plus Caribbean community,
Absolutely.
you know, at the fingertip of care. You know, our gay community at the Black Excellence Stage and Lounge for Stonewall Pride at the fingertips of care, and that touches the communities that we just spoke about that are at the top. You know, to think that black women are the leading ones that are getting it now is important to know. And how do we factor that into the equation? I think the cookout did a good example of that, of, you know, bringing those people into our world, because it is a stigma. You know, and I just commend you, Tonio, on the efforts and the participation that you have taken. Like,
Thank you so
I
much.
see you at more, you know, hetero events than anything, you know, and
A lot of work.
and putting yourself out there, and
Thank you.
HPTN 096 out there to know that, hey, this is more than just our community, and we have to span out to the other communities to make sure that we reach everyone, because ending the HIV epidemic, which First Lady Kendra's on the council of for Broward County, isn't just going to happen by touching the ones in our community.
Correct.
You know, it's going to happen by going out and reaching all of our black and brown community, which hopefully we're all doing our part in, you know. So make sure when you go out to Chocolate City that you're bringing your straight girlfriend and guy friend, you know. Make sure when you're promoting as a peer supporter, you're going to ally events as well, you know, and make
Non-traditional
sure
places.
you know your facts, you know, like First Lady just corrected me. Make sure you know your facts, you know, that,
That's right.
hey, you know, it's not only us gay men who are affected by this in high numbers, you know, so it's important all around the board, and we all have a hand in it here. It's unique that we do. You know, you're normally not sitting in a room with 5 and 6 or 4 people that have their hands in really bringing a community into a understanding of healthcare and what it means to get into service and resources at your fingertips. So I'm proud of everyone sitting at this table, and I think that's all we can do is continue to fight the good fight, right?
That's all we can do, is just fight a good fight, and just, you know, like, for the world hearing this, you know, what we need the most right now is allyship. That's the only thing we need. I mean, it's so unfortunate that the black gay community, the queer community overall, you know, we are oppressed, and there's a lot of hurt people in our community. But when you have more allyship, that right there can actually reduce, you know, more stigma more than ever, because now we finally have the support. So for all the allies out there, it's time to show up now. This is the time to really show up and show out for us, because we need you now.
Right.
So
Right, definitely.
And this whole thing needs to be taught in school, not taken out of school. Taught
and at home.
educated. You know,
At
'cause
home.
most people
At
are
home.
At
so
church.
Yeah.
Everywhere.
Yeah, everywhere.
everywhere.
School, church, home, all of that.
That's
because
right, yeah,
because like
it's
we
true.
just said, it affects everybody.
Everyone.
So other
You
than
know, they're busy
thinking,
trying to take the education out of the
Away,
schools. They
yeah.
really need to start younger
Right,
and younger.
right.
The only way that we're going to to get ahead of it.
Right.
Where to start.
And again, you know, these partnerships, and I can't thank Can Community Health and Midland Medical enough for the partnership, because they're stripping that away. Like
right.
Mark just said, they're taking it out of the schools, you know. It hasn't been in the churches. The stigma in the homes are not allowing families to speak about it, you know. And, you know, so all of these components is just that much more reason why this partnership means something, because it's being taken away from so many aspects and not being available in aspects. So now you're going to a fun event, and then we hit you with the free flight, and you go get tested, and or you know your status and all this stuff, and it really speaks to what that synergy looks like.
Absolutely.
So I can't thank all of the partnerships that make that possible. That is a big LGBTQ story for today. There is no other queer nonprofit media platform like this in the entire world. Support our LGBTQ stories by subscribing and sharing Queer News Tonight.